This is Cookeville High School. In a lot of ways, it's like any other high school. But one weekend per year, something very special happens here. This high school in rural Tennessee is transformed into a RAM clinic. Over the course of 2 days, 500 to 1,000 people are given medical, dental, and vision care, completely for free. It's no coincidence that this happens in Cookeville. This small community is among the least healthy in the United States. The rate of uninsurance is 50% higher than the national average. There are just a third as many doctors per capita and a seventh as many dentists. Worse still is the drug epidemic. The overdose rate is nearly double the Tennessee average and quadruple the national average. In the counties surrounding Cookeville, the number of overdose-related deaths has risen 400% since 2017. There are countless places in America where the healthcare system is neither healthy, caring, or a system. This is an extraordinary story of how one of these places is being given a second chance.
Hello, yes, sir. Good morning. What's your last name?
It's 5 a.m. on a Saturday morning, and hundreds of people are lining up to volunteer with Remote Area Medical. RAM is a national nonprofit that puts on single weekend pop-up clinics in underserved places across the country. They haul millions of dollars worth of medical equipment in 18-wheelers, transforming places like Cookeville High into full-service clinics overnight. Patients often come from hours or days away. They wait in their cars overnight and are checked in by volunteers. In fact, RAM relies entirely on volunteer health professionals who come from all around the country. This means RAM can provide their services at no cost. No insurance, no ID, no questions asked. If you show up to RAM Clinic, you will be helped. Triage nurses like Donna play an essential role in keeping the clinic moving.
Hey, my name's Donna. I've been volunteering with RAM since 2017. We got here, my husband and I, at 4 a.m. to get volunteers registered and in. I've been a paramedic for 12 years and a nurse for a year. So part of what motivates me to come out here is to actually participate in the process of getting care to the people who need it the most, the uninsured, the underrepresented in our communities. I love that they come out and do this in areas that don't have a whole lot of resources. Usually your resources are concentrated in metropolitan areas. So being able to reach out in rural areas is such a great opportunity. What I love the most about RAM is bringing students out. Nursing students, paramedic students, dental students, they get to come out and experience, real life, real medicine, real dental, instead of just being stuck in a classroom.
It's common to see students and providers eating at the same tables. It's a great opportunity for students to learn more about RAM's medical, dental, and vision bays. Dental and vision are the most sought-after services. Many patients haven't seen a dentist in decades or had eyeglasses in years, as one volunteer explains.
I'm Berlin Hatfield. I'm a RAM volunteer from Knoxville, Tennessee. So I've been a nurse for 38 years, and I joined the Air Force, got the GI Bill, and went to college. And then after I got out of college, I got a commission in the Air Force and did 24 years total as a flight nurse, about 7 or 8 of those years. And I've been deployed 3 times, been all over the Middle East, and then retired.
What's your experience been like today at Cookeville?
It's amazing. Every clinic is amazing. Just have patients who, this is their only source of health care. They'll wait a year and come to these clinics to get their eyes examined or their dental work done.
So in all these clinics that you've been to, are there any specific experiences with patients that have stood out?
It's always, for me, there's always something at each clinic that I take away. I think the story I've been telling recently, there were 2 patients in Knoxville. And this gentleman came in, he was obviously homeless. He had an old military raincoat. I'm retired military, so I know what it was. He had tied it together with shoestrings, and he had his coffee cup hanging from the shoestrings. He had 2 bags. One was with his underclothing, and the other bag had some of his personal belongings. And when he sat down, I asked him why he was here. He took off his glasses, and there was a string around here that had the arms tied together, and the bridge of his glasses was broken. He had walked in total about 30 miles to get his glasses.
Vision is something most take for granted. But for those who are not as fortunate, RAM clinics can literally give them their eyesight back. It's an empowering process that can change a life forever. Patients pick out frames that they like, often with the consultation of optometrists and opticians. Once their frames are chosen, they're sent to the mobile vision lab. In the lab, volunteers fabricate prescription lenses by hand. It resembles an assembly line, with each volunteer manning a different piece of optical equipment. And this is where the magic happens. These $100,000 machines use diamond-coated sanders to shape each lens into exactly the right prescription. The glasses are ready for pickup that same day. For patients like Lauren, this can be life-altering.
I'm here to get glasses today. I've not had glasses since I was a junior in high school, and my eyesight is getting worse as I get older, and I need some.
And how old did you say you were going?
I'm 21 years old.
Did you come here yesterday?
Yes, I got here at midnight last night.
Alright, so you're waiting in the car overnight?
Yes.
Okay, I see.
I lost my insurance whenever I turned 18.
Okay, so you had to leave your parents' insurance.
Yes.
You weren't able to get glasses.
No. It's just so expensive
Yeah.
to go get a prescription and to go get glasses. It's just way too much money.
Yeah.
And if you don't have insurance, it's even more.
Yeah.
And so I found this free clinic, so I was like, I need to go and get them because I can't see at night.
Yeah.
So I live with my mother. I live with my mother and my 2 brothers and my stepdad. I help my mother take care of them. Her health declined like really bad after she gave birth to my latest brother. And so she's had to have a lot of extra help with the boys, and she can't do it by herself anymore. So I stay and help her and make sure that the kids are taken care of. And for the most part, I try to use the health department for most of my needs. I did have to go to the emergency room like a year ago, and I'm still paying on that. Like, it's like $1,000 that I'm still having to pay off of that. It's just crazy. I don't know. I've just been trying to pay little payments at a time on it because it is a lot.
So are you working right now?
Yes, I take care of a boy that has cerebral palsy. Best job ever. I work in his home. He's a very bright young boy. Love him to death. I've been in the medical field since I was 18 years old. I've mostly been a caregiver at retirement homes and nursing homes and private pay. I'm actually going to get my LPN in May.
Okay.
And I've already applied. I've just got to pay for my prereqs.
Yeah, that's really exciting.
Yes, I'm super excited. That's something that I've wanted to do for a very long time.
Yeah. That sounds awesome. So can you tell me a bit more about home and what your community is like, what it was like growing up, that sort of thing?
I grew up in a very small town. There was only 56 in my graduating class. I was always bullied in school because of my weight, obviously, because it's a small town and everybody is the same there. But that is okay too. I grew up with my grandparents. My grandparents raised me and my brother actually. My parents suffered from drug addiction whenever I was little. It's really bad in that community just because it's so small knit, and it runs in the family. If you get me, like I'm the one in my family that has decided it stops with me. We're done with that. We're not going to go down that path, and your life is so much more worth it than to do something like that. I try every single day to help my little cousins because their parents also suffer from drug addiction, and I try to talk to them about it and make them understand that just because their parents are like this does not mean that they have to end up like that. It's just like you watch them go through stuff like that, so you don't want to be like that. You want to be better. You want to be better for your children. Like my mother, she went to jail when I was 14 and got into a thing called drug court in McMinnville, Tennessee. It helps many addicts. It is a very good program. And it saved her life, honestly. My best friend also, she's currently going through the program, and it's fantastic. If you're ready to do it, then it has such a great impact on you and a good outcome, because you have people that have been through the same exact thing, and they can share their experiences with you, and they can teach you things on how to take care of those bad habits, to stop those bad habits. She has been clean for going on 7 years now because of that. She married my stepdad. She had 2 more kids. She's really doing great in life, honestly. I'm very proud of her. Very proud.
As Lauren's case exemplifies, RAM clinics are about so much more than medicine.
If you could start reading the letters for me, that would be great.
Between the medical exams and diagnostic equipment, these clinics are hallowed grounds, rich with the human experience. Vibrant patient narratives reveal the realities of our nation's neglected spaces and people. Jeff has a lot to say about this.
Hello, I'm Jeff Moore, Sparta, Tennessee. I'm 53-year-old and here getting my eyes checked. We got here probably around 3:15 this morning. They come through, woke us up at 6 this morning and made us aware that we'd be getting a text anytime, and now I'm this far along in the process.
And so how many RAM clinics have you been to?
This is my 3rd year. Last year we come through and did the vision as well. My eyes has really went downhill just since last year. That's why I wanted to get them done again. And medical. And the first year we came, we did dental. They gave me reading glasses last year, and according to what the eye doctor said a minute ago, I'm actually showing signs of farsightedness now.
So how long has it been since you've been having some eye issues?
I noticed probably 5 years ago my eyes going down, and then finally, heard about this place, and I mean, it costs quite a bit of change to go to the eye doctor, and glasses ain't cheap. It's probably the most extensive eye exam I've ever had in my life. I have right here. There's a lot of tests here that they did that I've never had done before. In all my years, I've never had done.
Yeah. So do you have any insurance or anything right now?
Well, when we first started coming to RAM, no. My wife has it where she works now, but even with insurance this day and time, I mean, it's still expensive for the average family. I mean, it really is.
Yeah. So tell me more about your family, what you do for a living. That sort of thing.
I'm self-employed. I'm a handyman, or pretty much do a little bit of anything. I'm an electrician. I'm a tree topper. I'm a carpenter. Pretty much a skill set of about anything, really. My wife calls me Mr. Broke It because I get lucky a lot on fixing stuff. I mean, I'm blessed. I'm blessed to have the ability I got. born and raised in Sparta. My wife, she's from Sparta as well. She's got 4 children. They're pretty much grown now. I mean, I grew up just about 15, 20 miles from here. Like I say, I dairy farmed pretty much most of my childhood was on the dairy farm. Work. When I was a child, that's all we did was work. And, it's crazy. Look back today, the family farm pretty much almost gone. I mean, really. I think there's one active dairy farm in White County now. When I graduated high school, they was 100. 30 plus years.
Yeah. What happened to all those farms?
They just went out. I mean, mainly government buyout and just can't afford to farm no more. I mean, that's a whole nother issue.
Yeah. How do you feel about it? Like,
it stinks. I had my lifetime and whatnot, but, kids today, what are they going to do? I mean, really, truly, where are we going and where are we going to wind up? I ain't going to have to worry about it. When I was growing up, I guess one of the biggest worries was whether it's going to rain or something like that the next day. I guess, now, who's going to drop the bomb or, it's crazy. I don't know what to say. I mean, this world is really changed.
Yeah, absolutely. So one more question for you, Jeff. What do you look forward to in life?
So I guess I'd have to say what I look forward to is just being able to get up and being blessed enough to be able to get up and walk out and come to somewhere like this, and just spend the day with my wife. See people. I'm a people person. I talk to a lot of people daily. People say, "How are you doing today?" I'm doing better than I deserve, by far.
Jeff's story is emblematic of an America that once was. But farming and vision care aren't the only things that many Americans can no longer afford. Dozens of dental tents line the gym floor of Cookeville High, and they're the only form of dental care people like Sarah can count on.
My name is Sarah. I'm from Ohio. I came on Friday for the 19th clinic. Saturday morning I had 8 upper teeth pulled and I'm getting lower teeth pulled as well. They did a really good job. I had 2 of the younger guys and I was shaking and sweating. Because the last time I got a tooth pulled it was infected and I screamed and cried. There was kids there that did better than me and I was screaming and crying. And so I told them that and they numbed it. They did a very good job. I didn't feel a thing and they were quick. Yeah. Everything's healing already nicely. The swelling already went down. Yeah, they did a really good job.
So why were you trying to get your teeth pulled?
I've been on methadone for 6 years, and it literally rotted my teeth from the inside out. Like, I had very nice teeth all through my life, and then I started the methadone, and they started cracking and breaking, and so I just decided to get them all out and start over.
And what were you on the methadone for?
I had back surgeries, and basically methadone is to keep me, they were giving me like Opana, strong stuff that I didn't need to be on for the rest of my life, so.
So how long have the teeth been bothering you?
Oh gosh, they started probably about 4 years ago, that quick, they deteriorated. It was like one was bad and then another would get sore and then all of a sudden it was just one right after another. It was unbelievably fast.
Yeah.
Yeah.
So 4 years ago, were you able to get any type of treatment between then and now for your teeth?
Not really. And then I finally did get insurance and my husband passed away, so it didn't really take priority. And I moved from Ohio, came to Tennessee, and I had to cancel my Ohio Medicaid and then apply for TennCare and I got denied.
Mm-hmm. Do you know why they denied you?
I don't have cancer. There was like 4 other qualifying, like I'm not 65, I don't have cancer, a couple other things I didn't qualify for, I guess. Mm-hmm. Yeah. So.
That's weird because you should be able to qualify wherever, right?
You would think so.
You would. State changes.
Right.
Yeah.
You would think so, but nope. We appealed it, of course, and I think I'm still going through that process. But I didn't want to wait any longer. I started having tooth pain again, so I came down here. I drove from Sevierville, Tennessee, which is where my family lives. It took me about 2.5 hours. Well worth it, though. And, I was kind of weary about waiting in line. I thought I'd have to come park and stand, and I brought a chair and everything. But you're allowed to wait in your cars, and they have volunteers throughout the parking lot, so it's very safe and, very relaxed.
So, Sarah, can you tell me a bit more about your personal background
Yeah. Been a waitress for 28 years. You don't ever have the best medical or dental when you're a waitress. And even like I work for the Waffle House right now, and I can get medical, but the dental is really expensive, and it's really not worth it at the end of the day after the deductible and how much you pay. So my mom raised me. She was a single mom. I didn't really know my dad. He died a year after I met him in high school. I did really good in school. To me, growing up, it was all about my grades and, going to college. And then I had back surgeries. And I went back to college after I rested, and my back was pretty bad. I've got a lot wrong with it. So I need 3 more surgeries. I've got 7 ruptured discs, bilateral central stenosis, retrolithesis, scar tissue, nerve damage. It's a mess. So yeah, that's why I was on so much pain medicine and then the methadone, and it was all just, I guess it all dries your mouth out and it's really bad for your teeth.
What was the initial back problem that you had surgery for?
I always had back pain since I was younger, and they always thought it was like my female issues. And come to find out, when I was pregnant, I was 24 with my daughter, and they said I had ruptured disc and then needed surgery, and a year later needed another. And I guess they say it progressively gets worse every year. So it's bad. But I met my husband when I was a senior in high school. I bought a car off of him, actually. And then I went to college, and we stayed friends. We were best friends, and we dated for like 9 years, and we were married for 28. And he just passed away in October, and I moved here to be with my family.
That must have been really tough.
Yeah, it was.
Yeah.
It is. It's still very hard. 28 years is a long time. That was my whole adult life I spent with him.
Yeah.
He was my best friend.
Yeah. So why do you think programs why do you keep them in? Why does the need exist?
Because of life. I mean, life happens. You have one plan for your future, and then all of a sudden it's like you look back and it's like, wow, I should have done this way or done that way, and you end up at a different job because you were a single mom and you need the hours, and then you don't get insurance. And in Ohio, they did start where everybody could get Medicaid, and Tennessee is not doing that yet. They're very, I guess, strict on their policy. So if it wasn't for RAM, I don't know when I'd be able to get my teeth done. Yeah. So I'm very grateful.
You were mentioning that, you don't plan for things in life, it just happens. But are there things that, you wanted to do differently looking back? Or is that what you mean?
Yeah. Like, if I wouldn't have had my back surgeries, I would have finished college. And I'd probably have a better job and better insurance.
Last question for you. What do you look forward to in life? What brings you joy?
The newness of things today, for me. Meeting new people, trying new things, that's what gives me joy today. My children always give me joy, but for me personally is trying new things, We get stuck in our own ways, and all of a sudden you wake up one morning and you're like, I'm 46 years old and my husband died, and what do I have? You know what I mean? My life's just not where it was supposed to be, and you just wake up and, you thank God for what you have, and you wait for those opportunities to come, and they do. And then you can enjoy life again.
It takes a lot to be a provider at a RAM clinic, and provider stories are often just as rich as their patients. Everybody has a different reason for being here, but as we'll see in these next 2 cases, faith can be a powerful motivator.
That's good. Okay, so that's all consistent. So do you take anything?
Hi, I'm Donato Barillo. I'm one of the physicians here at Remote Area Medical. This will be my 4th year, but I've been on 2 deployments with RAM in those 4 years.
tooth legs?
Yes. The common conditions that you see are hypertension, diabetes. But you also see a number of musculoskeletal aches and pains, and also abdominal discomfort.
Are you currently still practicing?
Yes. So you have a general practice and occupational medicine. I'm board certified by the American Board of Preventive Medicine, so this fits in nicely with that. Also do a lot of wound care and hyperbaric medicine.
And where do you practice right now?
Right now I live in East Lansing, in Michigan. We flew in a day ago from Detroit into Nashville. We flew in, we'll be flying out on Sunday. Our group was through Joyce Meyer Ministries. Within Joyce Meyer itself, we have nurses and volunteers that come from Colorado, Arizona, Tennessee. So it's quite diversified as far as where they come from. If you just turn on TV on a Sunday morning, you see Joyce Meyer, and she's, again, quite the proficient book writer. They're books that give you a lot of guidance, even on just simplifying your life and doing a lot of things for helping others. So she has programs that build hospitals and schools and wells and fresh water in Africa. Of late, decided to do more domestic. With Joyce Meyer Ministries, I've been to Remote Area Medical, but also to El Salvador. It was a small fishing village that hadn't seen medical care in a couple of years, but again, the people were fantastic, very warm, very receptive. You just try to do as much as you can for them. With Joyce Meyer, it's obviously God-centered, and the more you think that you don't have time for something, the more you think that you're unable to set aside a weekend to do some good, you tend to find a way through God that just gives you more time. It's really amazing when that happens, as far as giving back or giving up yourself. For me, I tend to find that I have even more time to do that. Even though Remote Area Medical is non-denominational and doesn't have a religious backing to it, and the people are fantastic. They're emulating Christ-like actions. Everybody is so kind and so giving and so volunteerism that you just want to step in and do stuff. I mean, it's contagious. It really is.
My name is Dr. Raj Patel from Tulsa, Oklahoma. This is my second time that I've been at Cookeville, Tennessee. But I've been with RAM on, I think, 4th or 5th trip. Very well organized group.
How's your experience at Cookeville been so far?
It's been good. We've been busy. Not much breaks, but that's okay.
How many patients have you seen?
I would say maybe about 70 or 80 patients.
In one day?
In one day.
Wow. And how many extractions is that?
I don't really count, but I've been told it's about 350 to 450. You just be nice to your people, and you realize that God made everyone equal, and we get to help them out in whatever needs they have. In my case, I'm gifted with mouth and teeth, and fortunate enough to be a blessing to many.
So you said you've been to over 50 countries. Can you tell me a bit more about your background?
Yeah, well, I grew up in Zambia, Africa. Did my high school in England. I started University of Tulsa in Tulsa, Oklahoma. Graduated at OU Dental School. I went back to TU Law School. So I was about the only person of international descent 32 years ago in my class. I went to Bible school as well.
Wow.
And actually I got my MBA from Wharton School of Business last year.
Wow.
When COVID happened, I figured might as well do something else with life. This is America, right? Land of opportunity, and they still exist here. I didn't want to waste them.
So can you speak a bit more about all those missions that you've been on, all those dental missions?
Yeah, so it's with Enjoy Everyday Living and with our church. So we've been to Africa, about 12, 13 countries there. That covered all of Central South America, even China and Thailand, and Russia actually as well. Praying for the people of Ukraine right now. But I would probably say where I probably felt the most was in Madagascar. The lines were actually huge, and there were conditions and things I had never really read about or seen in my life.
So my friends were also telling me a bit about some of your personal background. You'd like to run marathons. Can you speak a bit more about that?
Sure. So I have run Boston Marathon 10 years in a row, and you have to qualify for that one. but I've done over 159 full marathons. But I think my name of fame is running 7 marathons in 7 days in 7 continents. But I actually got to beat the American marathon record holder, Ryan Hall. He's about 30 years younger than me, in Spain, Europe, and in Australia. So anyway, that little sidebar.
So you're here running marathons, you're a dentist, you're a lawyer, you got your MBA, so many things. What motivates you to, do all this stuff and be as active as you are? Just getting through it.
I think eventually it comes down to giving God all the glory for me. My kids are an inspiration. My wife is a jewel, and I think it all boils down to the family, right? Sometimes we have to do stuff to keep ourselves out of trouble. And I think if you choose something, choose healthy habits.
So you've been to a lot of places on medical missions, and I was wondering why you think the need exists for this type of care.
Oh, definitely, because dentistry, the question you asked earlier is it's become very expensive. And I think as more politics play a role, it might even get more expensive. Even in the U.S., there's probably less than 50 to 60% of the people that actually get good dental or have access to dental care. So for RAM to be there, the lines are huge. People line up for 24, 38 hours, and this is happening in America. It shouldn't be that way. And if RAM wasn't there, there would be at least maybe even 1,000 patients today that might not have got the treatment that they so much needed. The RAM is really well organized. So for practitioners to be fruitful in their labors, then something like RAM is perfect. Are there going to be patients? What if? You can cut out all the what ifs. Show up, and you'll be used.
Yeah. Do you have any thoughts on what we should do as a society, as a culture, to kind of reverse this type of trend?
Those are deep theological and philosophical questions, and they make a lot of sense. When you figure it out, let me know.
The truth is that while these clinics change lives, societal problems persist. As we've seen from patients today, health is as much about medicine as it is about our communities and cultures. Sometimes it's more complicated than insurance and money, as we'll see next.
Glasses.
Yeah.
I have glaucoma, and my diabetes now, so everything changed to where I need them more so. And it seems like the insurance I have will pay for them, but you don't get the quality and the bedside manner and God's country's right here, in the RAM clinic. Everybody's doing what they should be doing. Helping other people, being kind. That's the RAM clinic is wonderful. I want to say 2 years ago, I went to the RAM clinic and they did give me teeth that fit and I could eat. And the glasses, the first time I went and got my glasses from them, I went and down the street I was going, I could see somebody picking their nose. Just saying. I was like, hey, I seen you. I was all excited because that seeing thing is something, and they do such a good job. You get your glasses the same day unless you get bifocals. They do give mammograms. We did have somebody come by and ask us if we wanted to have a pap smear. I'm like, no, we're at Bristol Motor Speedway and you're asking me to spread my legs. No. That's what I told them. I said, no. Hey, went around asking everybody. But, hey, they made sure that women that needed it could get it and not be embarrassed. They were awesome.
So tell me a bit more about home, your hometown, and what it was like growing up and what it's like right now.
Oh, well, my hometown is Ocala, Florida. Not California, but Ocala, Florida. And I lived through a lot of bad things. I was bit by a mosquito, got spinal meningitis, went into a coma for 2 weeks. That's when they started putting traps out and finding that mosquitoes carry diseases. Got bit by a cat, Gave him cat scratch fever, rabies. Growed up and saved 5 kids' life, grabbing a snake. And that's what this all stems from. My blood veins shrunk from the antivenom because it was poisonous and toxic. In Florida, I worked outside because I'm illiterate. So I trimmed trees around the power lines for Asplin. I set mobile homes, modular units for construction sites, GE and Acton trailers for, I did men's work because I didn't really look forward to nothing, you know. When I'm moving up here saved my life.
From Florida.
Yeah. People gave me encouragement, you know. I practiced. They wrote stuff down that I would need to know to become a waitress at Shoney's. And I did it after like 30,000 times. And I mean, it's just, I think up here just gave me life back. I met people here that just, they're better than my family. I mean, love them. They're my family. Hello, Miss Lynn. Your arms are full.
Yeah, I got free stuff.
I know, baby. Thank you very much.
I just had some breakfast.
You did. You cheat.
The breakfast in that room wasn't just for the volunteers; it was for everybody. And it's
Oh. So I get to eat. And see? And I said something to everybody about that, didn't I? Didn't I say? I told them all, they feed you. They give you drinks. They don't just...
I got some nice coffee. I got some good coffee.
Yes. Yes, ma'am. And you're going to have glasses. You got them?
No. It'll be 2 weeks because I'm got they've ordered
bifocals.
They had to order that bifocals because they said I've got glaucoma. I'm originally from Scotland, and I love it here in America. And I have a kitty cat at home, and she has one particular pillow she sleeps on, and that one night I couldn't find her. She was up above my head. She was up above my head, and she curls up next to me.
How old is she?
She is now 7 years old.
Wow. So tell me a bit more about your friendship.
It was strange how it happened that we just went, I just said hello to her, and then my husband asked if she needed some help to move some things in, and she said, no, I can do it myself. She was different.
I had my legs in.
And she was trying to be dependent.
Yeah.
Independent and do it for herself. And she didn't want no one else's help. We offered, and she said no.
But I wanted, because I was going to have to do it all by myself anyway, you know. Once my leg's gone, I have to learn to do things, and if people do it for me, what if I can't do it then? So, bless her heart. She will do anything I tell her, you know, because she wants to do it, you know, but
sometimes you want to do it, you want to do it yourself.
Yes. And that's like the Ram Clinic. I started getting ready a day before, packing up. I made a bed in there, you know, and everything. But at the last moment, I waited until she got there, because I told her, I said, you're coming with me. So she could get glasses, so she could do stuff, you know.
Yeah. How far did you guys drive to get here?
3.5 hours.
Yeah,
It
3.5
does
hours.
take you, but it took us 6 hours because I can't see. And at night, oh my gosh, everybody mad at me. You know? She's healthy as a horse, though. Just saying.
Except from what that one said it is probably what I have is rheumatoid
arthritis. Yeah.
And it's he said that I can get worse if I don't move, which I have been. I've been moving.
You've been moving.
You said that you don't have insurance. Have you ever had insurance?
Yes, when my son was little, they took my insurance from me when they took him.
They took your son?
Yes, the state took my son.
Oh, okay. When was that?
When he was 4 years old. He was. Someone said I hit him and abused him, and I didn't. I wasn't an abusive person. But someone lied on me and got him taken from me, and said that I didn't take care of him. And there was just a load of lies said.
And after that happened, they took your insurance, your health insurance away.
Yes.
9 years ago, they took your insurance away, and you haven't had any insurance.
No.
How have you dealt with your medical conditions since then?
She really hasn't. She needs like a mammogram, make sure she don't have breast cancer, because she's had children, you know, so I don't have no kids. Y'all are my kids. Y'all are all my screaming fetuses. They are, really. I took them all in.
I love her. We've got
Oh, I
such a close
get her
connection.
goat, though.
We've got close
I
connection.
can make her so mad. Just let me see that. I want that. Let me see. No.
She got my goat, sorry.
I'm getting all her goats. Got your goat, didn't I? I don't know what that's supposed to mean, but my dad and them all said that.
Yeah. One other thing I was interested with you, Ms. Lim, can you tell me a bit more about the leg and the prosthetic that you were able to get, when you got it, and what that process was like?
It's been almost a year since I got it cut off, and it's been hell. Because I've had to learn to do things. I can't even bend over and clean my own bathtub. I got this for Christmas.
They gave it to you for free?
Yes, my insurance. I can walk on it,
Yeah.
but I have to, I just really got to be in a small light, because I'm scared I'm going to fall.
Yeah.
What you got there, little girl?
Masks. I got extra
Oh,
masks,
my
and one of them's pink,
goodness.
and I got a kitty cat mask for myself.
I want it.
Sorry.
Uh-huh.
First come, first serve.
Do you have any other family that you live with?
My husband,
How long have you been together for?
12 years. I love him, but he can be difficult sometimes.
He
can
takes
tell.
advantage of her.
But he can be difficult sometimes. He's hard-headed.
That's the same, yeah. Same thing. Yeah. Bless her heart.
And he wanted to take my cat necklace that I bought off of her, and he's not getting it. And I have to hide it because I know what he wants to do. He drinks alcohol and he wants to take it and sell it. If he sold the necklace, that's what he would use the money for.
Has that been a problem at all?
Yes,
in your
because
house?
he knows that, and he's not supposed to. He's a diabetic, and he's not supposed to be drinking, and he's a diabetic. He's a bad diabetic, and he's not taking care of his health.
How long has the alcohol been a problem for him?
For many years.
It's a problem for her too. That's why I waited for her to come. I waited for her to come home because she was going with me. Yeah.
But he tried to say I wasn't coming, and I said, yes, I am. And
Yes.
I took my blanket, my pillow, and said, I'm going, and you can't stop me. This is my house too, and I have.
He doesn't do anything for her. He gives her $200 a month.
But that's not enough, and I should get more. Because he gets
He
$8.41 a month.
What's his job?
He's on disability. He should give me extra now that we don't have to pay the rent.
What will he spend all that money on?
Alcohol and ice.
Alcohol and what?
Ice.
Okay.
And
They're
she
gonna
knows
take a long
it,
time.
yeah, that he wants to hide what he does, and he says that it's no good. He thinks I'm stupid. He thinks I was born yesterday. When I know
Yeah. How long have you known about that?
for a long time.
Somebody broke your shit.
Is ice a problem in the community?
Yes, it is.
Oh yeah.
A big
Oh
issue.
God, yes. Yeah, because
Who knows? And they could put, as she said, they could put fentanyl in it. It could kill a person.
one of my friends, her daughter just died of fentanyl poison.
I'm so sorry.
Yep, just left, not even a month old baby. 4 babies actually, but the last one was not even a month. Scarlet. She's 31 years old. Everybody's dying. All the generation is dying. I don't understand. Because they're either killing themselves. Because I had a friend. Her daughter told her son to come in and get the phone in a couple hours. He could use the phone. He goes in there and finds his mom dead hanging. She told him to come in there. Everybody's dying. and they said she had 22 volume. What are those mind pills? Xanax.
Xanax.
I was going to say Xanadu. I was just saying.
You were trying to say it.
Yes. I took her over where I feed the cats. I have wild cats, 2 of them.
They're pretty too.
They're polydactyls. They have 8 toes. And I take her over there, and oh my gosh, she makes me laugh so much. Them cats, she's like, they let me touch her. They let me touch her. Because they don't let people touch.
They normally back up away from people, but
Yeah, they don't.
but they let me, and they know that.
And I'm allergic to cats, so I never picked them up. So once somebody picked them up, wow.
But they got used. Now they've gotten used to me, and they love me.
They won't even. They don't even. They go right to her. I told her that she is the cat person.
Yeah.
It's something about me and animals, and also children. Because remember that little boy last night came up to me at that. It loves in there.
I remember a story, and I can't.
Yeah, that little boy was giving me big smiles, and he seemed to be a child magnet and an animal magnet for someone with no reason.
They must know you have a good heart.
Yes, and that baby would give me big smiles. Smiles and had big big curls, and he was.
$5. I don't know what she's doing, but she looks business type. $5.
Yeah, she's on a mission.
Yeah.
Joy is an unexpected presence at RAM clinics. But despite the Lynn's infectious energy, their stories illustrate the multidimensionality of our health crisis. Everything has layers. We end with a New York City dentist who acutely understands the systemic issues in the health of our society.
How you doing? My name is Dr. Sassan. I'm working with Remote Area Medical, doing a clinic in Cookeville. This is, I think, the 4th time we've come to Cookeville, and I think finally we're running out of patients. People come here the night before, they wait all night long. We start seeing them at 6 in the morning and take care of whatever they happen. And in dentistry, it's very expensive. And in Tennessee, the Medicaid does not cover dentistry for adults, and so they don't cover optometry. RAM does dentistry and optometry primarily. We have some medical, but we try and catch the people from falling into the cracks. Basically, it comes down to cavities and how much damage the cavities have done. The longer it sits there, the more likely it is these people are going to get extractions. In my private practice, I don't remember seeing a 40-year-old that need to have all their teeth taken out. And here, it's pretty routine. We're seeing, dozens of people that need to take out the teeth, and there's nothing else they can do.
So why is it that there's so many patients at these types of clinics that need, all their teeth taken out as opposed to like your regular practice?
Well, regular practice, you have a relationship with the patient, and you'll see them over the years, and you'll be able to stop the problems when it gets so worse. But here, they don't. People see dentists once every 10 years or 15 years, or if it hurts, they'll deal with one problem, but they won't deal with the entire constellation of symptoms because they can't afford it. The patient will go through an acute period of pain as the nerve dies, and then the pain will go away, and they think they're good, and then 2 years later, they'll wake up and their face will be swollen because they're infected. And then they'll usually seek treatment with an antibiotic, and they still won't see a dentist because the antibiotic works, and then we'll see them a couple years later when the antibiotics stop working and they've got a disseminated infection. Down here, we're talking Mountain Dew, the big gulp. The worst thing you can do is like sip something sweet all day long. Sweet tea, Mountain Dew, something like that over there. And you'll start getting cavities. You don't get them fixed, they just like wear down. Cookeville is pretty representative of America. Down here, it's actually, you take a look at something called meth mouth. Happens pretty quickly. There's acid in the meth, and it eats away at the enamel. And so meth mouth typically is that you just see these black stubs down to the gum line. And the teeth are one thing, but you know that the whole body is affected by meth. And so you'll come in here and you'll take the teeth out, bing, 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 because their bone is so soft that they're not supplying nutrition properly. So It's America. The problem is across America. It's not just here in Tennessee. With RAM, we basically serve the Appalachian area, but I know next month I'm going to Philadelphia, and I'm sure I'm going to see the same problems. I've been with RAM down to Haiti. Haiti is got its own particular problems, but in a lot of ways, people in Haiti have better teeth than people in Tennessee, which was shocking. Because they grow up with sugar canes, so they get a couple cavities in the front teeth, but aside from that, they know they can't get any treatment, and so they take very good care of themselves. So.
Yeah. So would you say that those types of issues related to dental health have gotten better or worse over your career? What have you seen? Because you've been to a lot of these types of.
Yeah, when I started out, it was mostly when I started out, I've been with Rams in 2008, so there was nothing such as meth. It didn't exist. Back then, it was mostly tobacco use. We were seeing cancers from excess smoking and chewing and stuff like that over there. But I think things have actually gotten worse over time.
So could you go into a bit more about your personal background? Like what motivates you to be out here at these clinics when you could just be retired?
When I could just be retired, yeah. All right, so I'm basically a socialist, is what I am. I've always wanted to do some volunteer work, but the problem in dentistry is very equipment intensive, and so a lot of volunteer work, you're going to go someplace and you're not going to have really what you need unless you carry it on your back and take it through airport customs and everything else. With RAM, what's great about it is that everything is here. They have anything in the world you might need. You just got to show up and you can start working, and you don't got to carry a 100-pound sack around with you.
So what's personally motivating you, to be here?
The patient of the day. There's always one patient who always makes the whole weekend worthwhile. You catch one thing. Like today, we were doing triage. Someone came in. He said he had a toothache. He missed the cancer growing on the side of his face, and so something like that. That's going to change his life forever because we caught it before it was big.
Yeah. So just to touch on something you mentioned before about why the need even exists. Why do we have to have things like RAM clinics in this country?
Right. Well, what happened was in 1964 when President Johnson put together the Great Society, and he went to the American Dental Association and said, come join the Great Society and we'll provide dentistry for low-income families. The American Dental Association said, we're a cash business, we don't take insurance, we don't want to become part of the Great Society. So since then, all the federal programs do not have to include optical or dental in their Medicaid programs. And so that's where the hole is. There's no safety net here in Appalachia, where I come from. And if Medicaid covers dentistry, and if Medicaid doesn't cover dentistry, you can go to a city hospital, and they have hospital clinics where you can get treatment for free. Here, if you're poor with a toothache, you're poor with a toothache. No one's going to come save you. So.
Yeah. Well, why is it that in these states it's different than?
Well, because the federal government will, if you like Medicaid for adults, the federal government will pay 80% of the cost. The state has to pay 20%, and no taxes, no services. The states don't want to pay for 20%, and so they will not cover their citizens. So it's a combination of politics and bad luck.
Trembling in my bones, I sat there all alone. I cried and cried. I saw the moonlight's mirror glow on that old dirty city snow. I sat there feeling low, my. I found some fortune, found some fame. Found they cauterized my veins. Yeah, I've been fucked up, and I've been a fool. But like the shepherd to the lamb, like the wave onto the sand, I fix myself up to come and be with you. river's bigger than I am. It's running faster than I can. Though, Lord, I tried. Between the shadow and the storm, a little pup was being born. A little whelp without his horns. Oh my, oh my. Hey mama, meet me neath the moon. I will be humming out that tune. I've been fucked up and I've been a fool. But like the shepherd to the lamb, like the wave arm to the sand, fix myself up to come and be with you. Like the shepherd to the lamb, like the wave on to the sand, I fix myself up to come and be with you. Oh, mama, here I stand, mama, reaching for your hand. I fix myself up, come and be with you. Mama, here I stand. Hey mama, reaching for your hand. Fix myself up, come and be with you. Fix myself up, come and be with you. Fix myself up, come and be with you.